Good morning, everyone. I'm just waiting for a few more attendees to log in before we get started on this morning's session, the EUnite for Health Week. I can see many of you logging on. I'm sure this is going to be a really interesting discussion. We don't want to lose too much time. So I can see, yes, we've got a critical mass of people. My name is Jennifer Baker. I'm going to be your moderator today, and we're going to be talking about leveraging the power of the digital technology and innovation to build a sustainable healthcare ecosystem. Now, EUnite for Health ecosystem webinars are being hosted all this week. This is the first of a series of 3, and we do hope you'll be able to tune in. Now, EUnite was set up very, very recently as a recognition, I think, of the fact that we're at a turning point due to the COVID-19 pandemic. It is supported by an array of partners. I'll name a few: the Corporate Accelerator Forum, the European Cancer Patient Coalition, EFPIA, Europa Bio, Innomed, Junior Achievement Europe, Novartis, Scambelt, and the Y4 Institute. We will be hearing from some of those later on, and of course in the coming days, as well as Novartis is one of the key kickstarters of the whole project. We will be hearing from their oversights as well. Now, the objective is to raise awareness about the opportunities for a pan-EU healthcare system, really focusing on sustainability and the 3 pillars, the 3 S's, if you like: sustainable systems solutions. We're also going to be looking at tomorrow, data and digital, and on Thursday, innovation. But today, as I say, we're going to be really looking at how the vision needs to move forward in terms of collaboration. So, to give you a little bit of the outline, a little bit of housekeeping notes, we will be having, as I say, introductory remarks from our Novartis speaker, Kees Rox, but then we will go into a panel discussion. If you've got questions for our panelists, please do use the Q&A function, which is at the bottom of your screen. Just click on that and type in your question, and I will do my best to get as many of those questions answered over the next hour. Try to keep them concise and clear, and if they're for one specific panelist rather than another, please do also mention that, or if they're for the entire panel, say so as well. Today's session is being recorded, so it may be used later on if you missed something, but we love to see you paying attention and really getting involved over the next hour. With that, I think we are pretty much ready to go. So I'm going to hand over to Kees Rox, Head of the Region of Europe at Novartis Oncology, to tell us a little bit more about what this series of webinars is all about.
Well, thank you, Jen, and welcome everybody. I'm super excited, but also honored to be surrounded by such a great panel today. And as Jen said, it is 3 days, 3 sessions, and 3 topics, and it's all about the values of collaboration and sustainability. So how did it start? Actually, the crisis triggered this, right? A crisis is always, as we call it, a window of opportunity. And there was so much energy there, so much energy on collaboration, that we thought, okay, how can we take that momentum, those learnings we've all experienced, into the future and helping to make a better and a more sustainable healthcare system, pan-European healthcare system. So that crisis was actually, in that sense, very helpful to bring people to the table and to have really meaningful discussions. So it started as an idea, and already today I can say it has become a movement. So many people are chipping in, and Jen just mentioned, already 8 partners, really stakeholders working together and really pulling all in the same direction and working together in a very collaborative way. It started in April, when we had the patients, members of parliament and other policymakers around the table together, of course, with industry representatives and researchers as well. Because what is clear is that none of those parties can make the change alone on themselves. We really need to stick together and do it together and be serious about that. So that is where I am so pleased that that first idea has become a movement, and we have those 3 sessions this week. It is all around innovation, but then people start to think about, yeah, but how? So a lot of people brought up that data and digital will be a key part of that. And then the question becomes, of course, how sustainable is that? And sustainability has almost become a buzzword, right? It's also about energy management, green jobs everywhere in all industries, the carbon footprint and the price of that. But it's not limited to that. We also need a sustainable and an efficient healthcare system, addressing the inequities. And the European Commission is really helping to lead that change. So let's do it together. And the question actually is, which solutions can we bring forward? And if we can agree on that today, then we make the next step. So we need to work together towards building a system which is sustainable. And what we need to look at is today, the healthcare as spending in the European group on average is 9.9% of GDP. But in a lot of cases, this is seen as a cost. And we believe we need to change that mentality and see it as an investment. Because if we do this right, it will not only save lives, but it always will also support the economy and really improve how we work together and the results we create together, both from a financial point of view and saving lives. So for that, we need bold leaders, both in the private and the public sector, to really have a commitment for action, because only with real action, we will see the change. So the question is, with everything we learned over the past 1.5 years, can we use that to build a sustainable healthcare system, an ecosystem blueprint, ready for the future? And if your answer is yes, then the time is now. And let's keep that momentum going. So thank you for joining. And with that, I hand over back to Jan.
Thank you very much, Kees. Indeed, I've set out exactly the sorts of topics we're going to cover. And I think it is very impressive from a start only in April, just 2 months later, that we're already at this stage. I think one of the things, as you pointed out, the opportunities, if you like, from a pandemic are the silver lining. When you ask people about health in the past, they just think about themselves. And now if you ask people about health, they think about the health of the whole of society. So to talk about all of this and a little bit more about collaboration, please welcome our panelists. We have joining us Professor Dennis Oswald, founder and managing director at the Y4 Institute. Thank you, Dennis. Antonella Cardone, executive director of the European Cancer Patient Coalition, and Thomas Alvin, executive director at EFPIA, that is Strategy and Healthcare Systems, indeed, at the European Federation for Pharmaceutical Industries and Associations. And we may well have joining us alongside them a representative from the European Commission. But first of all, Dennis, let me start with you to kick off. You've devised a framework for assessing the value of health investment. So what have you heard from policymakers around this debate that tells us we're on the right track? Or what is missing from the European discussion that you would like to hear for a sustainable vision for health and wealth?
Thank you so much, Jan, for the invitation. And Kees, I would like to quote you. We have to foster a paradigm shift that health isn't a cost factor, but health is an investment, and that health is a driver of growth, employment, innovation, and better health in the end. I think this is really important, and the EU should take this into account, maybe also in the recovery fund, right? Maybe we can think about if countries invest in health, that they get better financial conditions due to their investment in the healthcare sector. But let me start with something else. I'm a little bit scared about post-COVID, right? The debts in all the EU countries and all over the world increased heavily. What happens usually after such crisis, and we have not only a financial crisis, an economic crisis, but also a health crisis, we need to save money. And that means that we may have to cut budgets. And in the decades before today, we cut budgets in health. And I would say we shouldn't do so. We should think about health as an investment and a contributor to GDP, a stabilizer of economic growth. Just to give you an example, if we talk about sustainability, the WHO announced to reach the SDG goal 3, ensure healthy lives and promote well-being for all at all ages, needs investments of 371 billion a year only in low and middle income countries. The Lancet recently published that we will invest $11 trillion in health up to the year 2030. Is this an issue? No. If we consider that these are investments and we need to take smart investments along the value chain of care, then these investments in health create in 2019 $6.3 trillion globally to the GDP. That's twice the GDP of France. And nearly 200 million people are employed in the health economy. Nearly 200 million people. And that's the reason, and that's my last statement, and then I hand over to the other panelists, why I wrote with Rifat Atun from Harvard University a policy paper for the G20, B20, and T20, where we announced if we can't measure it, we can't fix it. And we have to measure how high is the return on investment in health in terms of to the GDP contribution, the value added along the entire value chain, the spillover effects of the health economy, and last but not least, and that's important, the social impact. Because if we invest in health, the patients benefit from it, and this can be measured as well. And that's it, and thank you very much for the invitation once again.
Thank you, Dennis. Antonella, let me come to you. Dennis, let me come to set up exactly for you there to bring you in when you mentioned patients. Are we talking too abstractly about this in some senses? Are there enough concrete measures to actually focus on patients and their well-being and outcomes?
Thanks, Jen. This is quite an interesting question. So we need to make health systems more value-based and people-centered, as it will make health systems better suited to deal with the needs in normal times, but also more resilient to future possible shocks. So the words that you mentioned, sustainability, value, innovation, or also resilience, may just remain nice words or concepts if they are not turned into concrete actions that ought to be implemented at European level. We are now living a momentum. There is a significant focus on health at EU level. For example, the launch of the Europe's Beating Cancer Plan, the Cancer Mission, the EU Pharmaceutical Strategy, just to mention a few, show that health is now more than ever high on the political agenda, and we should exploit this momentum. So one of the most important lessons from COVID-19 is that we needed to make decisions fast and adapt to the challenges as they come. And these need to be speeded up to offer the right solutions to the patients. We need the flexibility of both financial mechanisms and regulatory frameworks. We need to build on the evidence, and we need to strategize for long-term sustainability. There is a need of strategic investment in prevention and disease management, as this would help improve health outcomes and reduce, if not avoid, unnecessary hospitalizations, which can be fundamental in times where hospitals are overwhelmed by the pandemic, for instance. So we need more flexible and integrated health funding frameworks are necessary to allocate resources where they are most needed and when they are most needed due to possible external shocks. So we must be prepared. Also, digital health is crucial and it's very important for patient empowerment, and it is a key feature of a person-centered system. A people-centered health system builds on informed people and patients, so a high level of health literacy of patients and healthcare professionals and clear communication between healthcare professionals and patients is fundamental. And it also leads to more credible, evidence-based guidance to care services patients need based on patient-reported outcome measures and experienced measures. So to conclude, a health system that understands and monitors the needs, the goals, the value and preferences of its patients and embraces shared decision-making and co-creation of care would be more resilient. And we saw how the lack of all this impacted our health systems during the COVID-19 crisis. So only through an effective collaboration among key stakeholders, we can achieve a sustainable healthcare system where all citizens have access to the same high standard of care. Equality across Europe is at our heart. Thank you.
Thank you, Antonella. Thomas, let me turn to you. I see behind you on your logo there, "We won't rest." And that is, of course, relevant because there's no quick fix. So I'm interested to know from the industry perspective, what do you see as feasible, as possible? You know, we've heard about sustainability, both from Dennis and Antonella, but resilience is another buzzword in particular that we're hearing after the pandemic. So give me your perspective on what you think is realistic.
Well, thank you so much, and good morning, everyone, and thank you so much for the invitation to this event. So I think, yes, we won't rest, and of course alludes to the pharmaceutical industry continuing to innovate, research, and develop to fight different unmet health needs, and I think that, you know, when we're now entering sort of this new phase of the pandemic, we all lived through 2020. We now start to see the light in the end of the tunnel, and I think, you know, it's sort of hard to overestimate what actually a huge success the fighting of COVID-19 has been in terms of, you know, resource mobilization to during less than a year, bringing highly effective, innovative vaccines and other therapies to patients, and it's been actually a success story, you know, that you can compare to the moon landing or those type of huge moonshots, and I think that should really teach us something on the value of you know, making these investments, the value of innovation, and I think we also learned a lot about the huge opportunity costs. You know, what happens if you don't invest in health? The huge cost that the pandemic has brought on people and patients, on health systems, on the economies, and where we would be if we didn't have these new tools to fight it. So I think that's very important to consider when we now start to kind of rebuild our health system and build back better after the pandemic. And I think, of course, it's important to say that these you know, these vaccines, these innovations, and also, you know, telemedicine, all the other things, tools that have been used, haven't come from nothing. And you know, looking at these, you know, some of these very new effective mRNA vaccines that have been deployed, of course, is the research is a result of years and investment and research and development into these technology platforms, originally for other causes. You know, many of these were developed to help fight against cancer. Hopefully, you know, that will come later. And so this was possible because this was already in the pipeline, and many companies were already involved in that. And I think that also tells us something about the long perspective we need to have on healthcare, health systems. And I think that comes back to the sustainability issue, that when we're talking about sustainable health systems, we're not talking about an annual accounting exercise. We have, here's my budget this year and here's how much I can spend. Of course, that's how many health systems in practice work at the budget holder level. But if we're going to talk about real sustainability, we need to look beyond that year, since we know that most health investments, they will pay off maybe 5-10 years in terms of better patient outcomes, better population health, and also more efficient systems, so you can actually save money through different types of investments, and also better productivity and the things that Dennis was talking about in terms of actually boosting the growth of our economies. So we need to employ a more or deploy a more long-term perspective of health investments, and also get out of the silos, the silo budgets in healthcare, and look at how can we have a more integrated way of funding healthcare, where you look at the outcomes and the resource utilization in a holistic perspective, and not item per item or intervention per intervention.
Thomas, thank you very much. Now, as I mentioned, we do have a representative joining us from the European Commission. So I thank you very much. I'd like to welcome Andrei Rees, who's the Director for Health Systems, Medical Products and Innovation at DG Sante, the health department within the European Commission. Andrei, thank you very much for being here. We've heard there from the other panelists, from the different perspectives of what they think needs to be done and what may be feasible to be achieved. Tell us a bit about what the European Commission plans to innovate with in the coming future, and to deliver really a thriving EU health system that is both affordable and innovative. And is there a way that both of these can be achieved in the sort of timeframes that we feel we need them?
Thank you very much, and sorry, Bilal, that was the Zoom connection didn't work. Good morning, everybody. So my, that depends how you see the role of the European Commission and the European Union in this exercise, because we were part of the response. So many things happen, because of the coordinated work of member states, European Commission, allocation of resources to different pockets of money. But of course, we have to look, for the future. We are passing very difficult time, and hopefully we see the light in the tunnel. But the number of areas we really have to carefully watch and simultaneously think for the future. I think this is the striking moment of the history that we still are in pandemic. We have all kinds of new developments, and at the same time, let's look for the future. So this is why first our after crisis management parts, when we invested, when we were purchasing jointly vaccines, when we were working closely with the industry, with member states, with all kinds of partners, to also global partners, to get right measures, at the same time respond to the problems. We started to also put kind of lessons learned and look for the future. The first package of legislation we proposed was in November, when we decided to modernize, the role of two agencies, European Medicine Agency and Center for Disease Control, to let them work better in the crisis and crisis preparedness. So there are a number of new functions they are going to have, and so we are hopefully finalizing soon the negotiations in the Council and Parliament with the whole package, including cross-border healthcare threads, which is important one, how we work together. We put additional relatively huge budget on the EU, the disposal of EU member states, the Recovery Resilience Facility, which allowed invest in also in health, but with also quite big target for digital and climate change. But we see how member states already are navigating. The percentage of money allocated in this fund depends of the countries, from few percent, but up to 30%, on the health side. So it seems that it's an important investment coming from this fund. We are going ahead with as already mentioned by colleagues with European strategy in pharmaceutical fields. When we put number of ideas we like to develop, there are 55 different actions, mixture of regulatory changes we would like to propose by end of 2022, but many actions which are supporting this strategy. Then we have a project which I think is really changing in the future, the European Health Data Space. This is the way how we can move health data across continent, allowing better research, better policy making, but also helping with number of processes, like for example HTA, post-marketing evaluation of medicines or medical devices and so on. And finally, we're able to propose the program, first time in the history, EU for Health program, which is relatively big, over 5 billion euros. I just remind those that are not familiar with this program, up to now we're able to allocate almost 10 times less from European budget, and so this is a really substantial investment in health field, in the health policy area as well. But also we should not forget there are a number of other activities around. We have big research program investing in health research. For example, cancer mission is a specific area of investment. We have new public-private partnership with industry, not only with pharma, but also medical devices and digital industry. So we really believe that there's not only money, because I don't see the European Union and budget should be the only way to go. We really would like to cooperate, build together, and get results thanks to right investment. Thank you.
Thank you, Andre. Well, if I may, a follow-up call. I mean, I'm glad you mentioned the Recovery and Resilience Facility. There is a lot of money there that is being distributed to member states. Again, though, of course, this does go to member states. And although health is a national competency, as we always say here in Brussels, we're talking about health as a broad social issue across all of Europe, because the pandemic has taught us that. Within the RRF, there is 37% targets for climate, 20% targets for digital. There's no specific target for a health. Do you think that there needs to be more of a focus on that? Or is there an assumption that countries already know that they need this at this point in history?
I think when you read the programs, you see the countries, they know. I think the first is important to hear member states and let them assess the needs, because a country which is pulling the biggest budget for health is Hungary. But we see also in other countries, even the percentage in the total budget is smaller. But of course, you should see this in the big budget, allocated to this country. There are substantial investment. Also, you can see that some countries, they would like to, for example, go very much the infrastructure. Others would like to put money to kind of investing in the workforces development. Some others would like to focus on specific areas of investment. And also, for example, when you think digital, better access to digital services will be better if the access to digital networks will be better. So we should not think, the health is because we much money health. When we invest in the digital infrastructure, finally, we will invest to the health and access, for example, to patients or to specialized doctors or to rural area or desert area. So and even have a look also on climate change. Reducing air pollution. We will reduce the problems, with chronic diseases like bronchitis or other types of pulmonary disorders. So think, always the health investment is not just money put to the health sector. Swimming pool for children in the city, it will be also good investment for health. So let's think, health in our policy, not just healthcare, hospital, drug, medical device.
Thank you. Well, Dennis, I'm going to come back to you and sort of explore a little bit further something that Thomas actually mentioned that I was glad he brought up, because vaccines didn't just come out of nowhere, as he said. They were the results of building on ongoing innovation. Now, we do have under Europe, we have, as well as the fund we've just discussed, we've also got things like Horizon Europe and so on, that there is a lot of facility there. Is that being directed in the right way? Do you see a sort of a decent, solid backdrop to moving forward with healthcare? And in terms as well of this collaboration element, are we seeing cross-border collaboration in the industry's innovation and research area?
First of all, thank you, Andrew, for your statement. And I fully agree. We have to break silos, and we have to place health in all policies, right, to create innovation, right? That's something I really would like to underline, that we have to think of health as a macroeconomic sector, right? But not only a sector who is contributing positively to the climate change. Try to compare this sector with other sectors. It's definitely positive, even if you would benchmark it to automotive, energy sector, and some others. It's definitely a positive contributor to climate change. But now to your question, we need to it's a miracle that we have a vaccine at hand right now with mRNA, right? It's a miracle. After 1.5 years, it's incredible, and I wouldn't. We have to be careful that a miracle not often happens, right? So we are lucky, and it was maybe a once in a lifetime miracle, and this helps us now. I see that we, as Europe, in the last years, in my opinion, it's we are good in innovation, but other continents are also very good, right? And we should think about how can we strengthen our entire innovation network, right? And I hope the EU did a great job in the last weeks and months to accelerate the process. But we shouldn't forget that there is a competition all over the world. And if you are getting in touch with medtech companies or other companies, they see that there are other opportunities, not only in Europe, where they do R&D, where they plan their production. And I think that we should use this momentum and this miracle that we had this first mRNA vaccine in Europe, that we should use this as a momentum to accelerate the process in innovation, connecting dots in different networks, thinking. I think we are doing a couple of good things, but we should foster them.
Thank you, Dennis. And I will remind our audience that you can ask questions of the panelists using the Q&A function. I see one has come in already, but do keep sending them in for all of our panelists. Thomas, I'm going to bounce back to you to build on a little of what Dennis had said there. Obviously, you're a European organization, but he's maybe broadening this out to a global scope. Can you talk to me a little bit about that, about the interconnectedness of innovation in the vaccine area? And of course, it's not a miracle, it's science, but how can we make it an everyday occurrence that something remarkable happens without getting perhaps sucked into the discussion about vaccine nationalism? What are the issues at play?
Yes, thank you so much for that question. And I think that yes, I mean, I agree with Dennis. We were lucky and we got some very efficient vaccines. I think also, there's a saying that luck comes to the well prepared. And you can actually be prepared to be lucky, and also, of course, in this case, and as I think Andre alluded to, that of course there was an investment in a huge portfolio of different vaccines, since that's the nature of medical R&D, that you don't know exactly what will work when you start the development process. So it was sort of an all-in approach on all the potentially successful vaccine candidates. Some turned out very well. There was a lot of who turned out well, a few maybe not so much, and that's a really shows you the kind of risky nature of R&D, that even something that looks very good on paper might not work later in practice. And we see this every day in the R&D space, that medicines that look very promising then fail at a later stage of clinical research. But I think it's very true what Dennis said, that we live in a competitive world. Different regions also want to get ahead. FBA a few months ago published or the latest version, the latest update of our pipeline review, where we look at what's in the pipeline of the innovative pharmaceutical industry. So what kinds of therapies, vaccines, and other products are in development and might come to health systems in 3 to 7 years. And there is a huge deal of very impactful innovation that is under development. But we also looked at where is this development taking place and where are the clinical trials taking place. And in many of the very breakthrough areas, not vaccines, we have a lot of good vaccine development in Europe, but in many other high impact and very advanced innovations. So probably called HMPs, so cell therapies, gene therapies, and also many other areas. A big bulk of the clinical trials are being done in the US. Also Asia is coming very strongly, China. And of course, this is something we need to think about, because there's of course a lot of focus right now in Europe on the manufacturing and supply chains, which is very important. How do we make sure that we have resilient supply chains, and of course in the start of the COVID-19 crisis, we saw some disruptions when different countries raised export restrictions and raised borders, causing problems. So where the manufacturing takes place is of course important, and you need a diversified supply chain. We should not miss where the R&D is taking place, because that's in a way the most high value added activity, and also hugely important for patients, because for many patient groups participating in a clinical trial, it's actually a very important part of the care, for instance, for many cancer patients, and the possibility of getting a new innovative treatment early. So that R&D perspective really needs to be part of the Commission's sort of when we look at not only health but also industrial strategy in Europe, because these things are very much connected, as I think Dennis talked about very well. So yes, this is very interconnected. As was said, R&D is happening globally. Manufacturing supply is happening globally, and many of the vaccines that we now have components from many countries all over the world. So it's very interconnected and complex manufacturing supply chains, and we need to take care of those. And as you said, not revert to a vaccine nationalism where we think that one country can do this all on their own, because that's just not possible in the world we live.
Thank you. Antonella, let me bring you in there.
Yeah. I would like to make a quick comment on the lessons learned from vaccination, from the quick access to the vaccines after during the pandemic, or as a consequence of the pandemic, that stays at our heart as a patient organization, and that is the acceleration to access. For us, the accessibility, the development and then accessibility to the vaccines is really important. And we do hope that all together now we learn from this lesson And we realize that skipping some bureaucratical or administrative steps can help enhancing the accessibility to innovative treatments. And for us, as I represent the European Cancer Patient Coalition here. So for cancer patients, as Thomas mentioned, accessing an innovative treatment is not just a matter of reducing the risk of getting the disease chronic. It's really a matter of life. You can live or you cannot live depending on how a treatment is accessible and how fast, how quickly a treatment is accessible. So this is very important. So now let's not go back to the previous status quo of all the different steps into the making a treatment available. So I stop here.
Thank you, Antonella. In fact, I'm going to turn, Andre, to you to ask you to comment on this point that Antonella is making there about access and bureaucracy that we have seen in the past that maybe could be cut in the future.
Yeah, it's true that when you see the whole development, we may analyze, maybe if Antonella provoked this kind of thing, with the bureaucratic or process. It's true what we have done, first during the assessment of those vaccines, the European Medicine Agencies really was able to set up the process, which is it was set up for the pandemic. We tried this first time in H1N1 pandemic. Now it was kind of used again. This is what I agree with Thomas. If you are prepared, you are lucky. So somehow the system was already kind of checked in H1N1 pandemic use or reuse now, with much more, of course, bigger portfolio and much more challenging momentum. But assessment went, relatively well. You remember December, January criticisms that we were later than the UK, later than FDA, US. But when you really see this in the way things are done in Europe, we were able to get to the normal authorization, conditional, but the regular authorization of the vaccines. The quickest in the world. The authorization in the US, in the UK was under emergency circumstances. So this is maybe one area I would like to also to kind of crash with the myths. That we were late. No, we are not late because we have different process and of course different responsibility for both for the public authorities but also for industry. For example, concerning liability. Then there's something I think many developers dream. Commissioner was able to authorize because finally we had this bureaucratic part when we were able to authorize medicine in hours before Christmas Eve. I can tell you my team was working like hell, not just my team, because it was whole machinery in the commission. It was triggered and ready to go, and President was able to announce this authorization. And then, then we have, of course, other important parts, which of course patients are very interested in, and every one of us, pharmacovigilance, which was also important because we in Europe were able to spot at first time very rare side effect of vaccines, and we're able to assess, and also first time we use big data to analyze this and try to look for the cause of this phenomena. So that I think the whole process, when you see this, was very well done from the regulatory. I still hope it's very well done from the regulatory point of view. From the money point of view, also we were quite innovative because first time in the history of Union, we're able to do the advanced purchasing agreements with industry. Basically, we invested EU funds to help with the building up the production capacity. Under conditions, of course, the medicines, or in this case, vaccines, will be developed. And again, this was the quite innovative approach. It's known in many areas, but first time we try in such scale, putting money on the six vaccine candidates. So So I think when you see this, the whole things, I think this is what Antonella was referring. So we were innovative as a payer, as a regulator, but we have done this. I think this is, I will stress this because it's an important message. We have done that jointly with all member states,
I want to come back to this question of health equals wealth on a very literal basis, on a societal basis. I think we have time probably for one quick round from each of you. And with that, I'm going to bring in a question from our audience member, from Felix Uhlhoven. Andre, I'll start with you because it's directed specifically at you. He's asking, is the Commission going to publish an overview of what national governments are proposing to do in the field of healthcare? But specifically, will healthcare reforms be considered as contributing to the resilience of European societies and the economy? So I'd like you to tell me what the Commission is doing and how we make this link between a healthier society being a more productive, a more useful, a more economically and future-proof society.
We already started this exercise with after a financial crisis. We should not forget this. What's happened, because we live from crisis to crisis. Pandemic, H1N1 show us we have to buy together because we should not compete like crazy, from the limited resources as vaccines or medicines in the crisis time. So this was lessons we employ now. For the financial crisis, we learned the health sector. It's big economic sector. This is what Dennis said. We are having up to quite high percentage of GDP, quite high percentage of public funding. We have also employing almost 10% of the whole working population as the health sectors. So we health sectors, we are big, but this was also understood, when we started to do so-called European semester, basically assess the national budget, in the kind of economic term. And part of the economic process was the way Commission started to put the recommendation for member states to kind of build a sustainable resilience health systems. Of course, COVID showed that even the trends were positive, because we should see the what's happened during last 10 years. In many countries, really, we have seen the progress in number of areas. We could go to the life expectancy, access. There were many good trends, but COVID came and said, I checked you, and checked with a very, very big pain. We have seen the problem with number of areas, digitalization, access. The way we manage, COVID, but also how we manage the patients. They were not COVID patients, or we didn't manage them often. So, and the COVID show the systems were not prepared. There were no resilience enough. And I think this is a momentum now. Again, we have to build on this. And this is why the investment member states are doing, there will be a number of areas defined by member states, but also assessed by the Commission, because we have this kind of moment when we assess those programs to see how the money can be invested. All these programs, I think, they will be publicly known from the government's website.
Thank you, Thomas. A quick wrap up, if you like, from you about, of course, healthcare is a big sector, but perhaps how is a well society a more economically viable society as well?
Well, I think that as I mentioned in the start, we need to have this more long-term perspective on health and on health investments, and also that we need to break the silos in health systems. And I think that healthcare is getting more and more integrated, and we talk a lot about integrated care. But Andre mentioned the new public-private partnership that will soon be formed, the Innovative Health Initiative. We used to have the Innovative Medicines Initiative between the pharmaceutical industry, the European Commission to have public-private partnership projects. And now we will get this more integrated also with the medtech sector, the digital imaging sector. And that shows that a lot of innovation that's coming is now integrated. It's drugs combined with devices or digital tools. And that also reflects how the healthcare systems are getting more integrated. And I think to be able to manage that and to be able to have these new, more innovative and more integrated way of funding healthcare, we need new types of partnerships, not just between industry sectors, but between all public and private sectors, and healthcare professionals, payers, patients, industry, health managers, and I think that's what we're seeing, that we're getting more and more of these, what I would like to call value-based partnerships in countries and regions, where actors need learn to work together in new ways, and I think that's the kind of partnership that the new Innovative Health Initiative will foster. We also have, EFPA as part of a new alliance at European level, the European Alliance for Value in Health, where we are 12 organizations across the health systems trying to work out what's the role of each actor in a more value-based and people-centered health systems, because there's a lot to work out. How do we, what kind of value does everyone contribute, and how do we, make the new health systems work better in the future?
Antonella, briefly to come to you, I know the EU Cancer Plan predates the COVID pandemic. In fact, I seem to remember it was the last big event I moderated right before we went into lockdown in Brussels. And what I wanted to ask you is, you've been doing this a long time. Are there lessons learned that people should be listening to you to hear?
Yes, of course. I want also to comment a bit on the breaking down the silos, which is not only breaking down the silos in between different stakeholders. It's even within the same government that we need to break down the silos. We need to break down the silos of thinking, and most of all, the silos of budget organization of our governments. Because if an investment is made in health and the return on that investment is on welfare, for instance, saving on early retirement or on the employment, keeping people active at work, that investment will remain a cost for the health system. So we need, so there is evidence, we need to build on that existing evidence and look for new ways to organize the budgets of different ministries. I mean, I do not have the solution. I've been talking about this now for years, but this is fundamental. And we need to look at the indirect costs of health and start considering work as an health outcome as well.
Thank you very much, Antonella. Well said. Dennis, we've come full circle. I'm coming back to you again to get your brief closing remarks before I hand back to Kees to get his thoughts. Wrap it up. I mean, you started out saying at the beginning, it must be a move from cost to investment. Are you heartened by anything you've discussed in the last hour?
No, first of all, we should be also proud of the EU, right? And what we all managed. And maybe that's the way we can still improve. And I would say if we can't measure it, we can't fix or improve it. And think about education dividends. You will find thousands of publications about investments in education. Why do you don't find a lot about investments in health or health dividends, right? And I think we need to invest smart. And I don't want to say that we have to increase our expenditures all the day, but we should break silos and try to figure out where can we invest smart, either prevention or in different elements, value elements along the value chain of healthcare. And that's, in my opinion, very, very important. And last statement, a positive signal, we still manage COVID, but I think COVID was a booster for efficiency in the healthcare system, right? We will see it. We will face a lot of challenges post-COVID, but I think don't forget about the changes within the healthcare system, how stakeholder interacted already. And I hope that this efficiency will help us to face all the challenges in the future. And thank you very much for the invitation.
Thank you very much, Dennis, and to our other panelists for setting out, I think, very broadly what is a huge topic of discussion. And of course, we'll be moving on to some more specific details tomorrow and Thursday. With that, Kees, I'm going to ask you to come back in. From the perspective of the EUnite, what have you taken away from today's discussion?
Now, first of all, a big thank you to all panelists and the discussion. And I think it is very clear that the movement is happening, but we're only at the start, because I think we have very, very strong insights And now I appeal to everybody also online to bring that together, pull together, collaborate together to make it happen. Because all of you mentioned the silos. The silos at the European level, the silos as you just did, Antonella, also in the healthcare systems in the country. And that is a solid proof that we still think costs and not investments. Because otherwise an investment in one area will give savings in the other area, right? Hospitals versus other healthcare costs, prevention, you name it. And people still don't think like that. So we need people like all of you to really believe that we need to bring down those silos, because only together we can make that change. And then we also need, as it was mentioned as well, look beyond Europe. What can we learn, right? We did great things in Europe around the pandemic. EMA was amazing. The countries were amazing, you know, trial approval, then drug approval, and bring it to patients, funding, everything. Really, the walls came down. So how can we make that sustainable? But also learn from what happened with FDA and how they're looking at innovation. What can we learn from them and bring all of that together? You know, we cannot suffer from the not invented here syndrome. We need to bring all learnings worldwide all together. So, and then, but only then, health can be equaling wealth, because otherwise it will just not work. So I close with what I close my intro with is, we need bold leaders, both in the public and the private sector, to make that change. And for change, we need action. So that's why we need those bold leaders. And then we can use all the lessons to make a difference and come up with an ecosystem blueprint for healthcare. So the moment is now. Let's do it. Let's keep the movement going. And I'm super excited that we have 2 more sessions to come this week. So thanks again to everybody for your contribution. I enjoyed it a lot, and I'm super inspired to keep this going. Thank you very much.
Thank you, Kees. Thanks for those remarks. Indeed, as you say, we've got 2 more sessions this week. Tomorrow's session is called From Buzzwords to Business Reality, Harnessing the Power of AI and Big Data in the European Healthcare Ecosystem of the Future. So that will develop on a lot of the points that were made this morning. So I hope you will be able to join us again tomorrow at the same time to talk about that. I also urge you, as Kay said, to keep the conversation going. You can do that on social media. Use the hashtag EUnite, EUnite, or EUnite for number 4, healthcare. And we can get everybody involved. Share with your colleagues. Do encourage them to join in the conversation as well. Thank you to our organisers, and I hope to see all of you again tomorrow.